Absolutely.
Look at all those fancy clothes.
All right, folks, welcome back to the Jack Stockwell Show. Darrell Catmull is sitting in for Jack. He will be back on Monday for his weekly update. This hour, we're going to talk about health care. As you know, health care is a problem in the United States as the cost of health care is soaring, and it's one of the most highly regulated industries, which may have a lot to do with that cost. This hour we have author Regina Hertzlinger of the book Who Killed Healthcare. Regina Hertzlinger has often been referred to as the godmother of consumer-driven healthcare. She's the first woman to be tenured at the Harvard Business School as the Nancy R. McPherson Professor of Business Administration. She is also a senior fellow at the Manhattan Institute for Policy Research. Hertzlinger is widely recognized for her innovative research in healthcare, including her early predictions of the unraveling of managed care and the rise of the consumer-driven healthcare and healthcare-focused factories, two terms that she has coined. Professor Hertzlinger has been honored with numerous awards, including the American College of Healthcare Executives Thompson Book of the Year Award twice and the Academy of Healthcare Executives Research Award 3 times. She received the Hospital Financial Managers Association's Board of Directors Award and has been repeatedly selected one of the 100 most powerful people in modern healthcare. Hertzlinger has served on the boards of directors of many healthcare businesses and nonprofit organizations, most of them consumer-driven, and advises members of the U.S. Congress. Professor Hertzlinger's authority on healthcare was solidified by the success of her previous books. In Market-Driven Healthcare, she addressed the need to reform the way healthcare is supplied. In Consumer-Driven Healthcare, she reviewed the way health insurance is supplied. And finally, in Who Killed Healthcare, her most recent book, Professor Hertzlinger issues a call to arms to revolutionize our healthcare system with a consumer-driven cure. Professor Hertzlinger, welcome to our show.
Great to be here.
Well, Utah is no stranger to high healthcare costs. I think we're leading or in the top 10 of people who do not have healthcare insurance, and a hot topic in our Congress right now is expanding the budget for putting children on the S-chip program. And I personally believe, without a shadow of a doubt, that if we socialize healthcare, it'll be more expensive and the quality will be worse.
Oh, it would be terrible. So, the healthcare systems in the UK and Canada, which are run by the government, they're fantastic, except if you get sick, and then you've really got a problem. Most of the Canadians, if they can afford it, including some of their political leaders, they come to the U.S. for healthcare. So who wants a system like that?
Yes, I've read a couple of articles on Google of people that are coming across the border to get their health care. And that doesn't make much sense.
And, it's ironical that these political leaders, they don't walk the talk that their healthcare system, the Canadian healthcare system, that's good for everybody else. But, gee, it's not good enough for them. What kind of leadership is that?
Well, the leadership is obviously appeasing to the masses and giving a perception that they have the best interest of their populace.
Right,
it's more about
they belie that by their own actions. Healthcare is 80-20, like a lot of things in life. That's called Pareto's Law. 20% of the possible causes account for 80% of what happens. So 20% of the people account for 80% of healthcare costs. They're very sick. 80% of the people hardly use any health care. Now, those people may be kind of happy with the notion that their healthcare system is free. They always say that in Canada or the UK. It's free. Of course, not free. They pay for it, but they pay for it in taxes rather than paying for it the way we pay for it through our employers and sometimes out of pocket. But they can be very happy because they never use the healthcare system. What about the 20% who are sick? Well, if you're sick with cancer in the UK, may the good Lord be with you, because you'd have a much, much higher chance of surviving if you were in the U.S.
Now, healthcare in the United States is one of the most highly regulated industries. Do you feel that consumer-driven healthcare can function well, even though free markets and regulated industries are paradoxical?
It's not a perfect setting. The healthcare suppliers, the doctors and the scientists and the entrepreneurial business people who make the rest of the U.S. economy so vibrant, they are in handcuffs in the healthcare industry. But even if they're handcuffed, if you let the consumer do the buying, our healthcare costs will, at a minimum, be controlled. They now inflate much more rapidly than the economy. And if we do what Switzerland does, Switzerland has a consumer-driven system, and it has terrific health care, and it spends 40% less than we do. Shows what happens when you let the consumers do the buying. Healthcare costs go down without diminishing quality.
So is it just arrogance on the part of our leaders to think that we can't take a already working model in Switzerland and apply it to us?
Yeah. There are a lot of people who think you're pretty stupid. They've been running the healthcare system for a long time. They've been in the insurance industry. They've been in government. They've been among the leadership of these giant hospital systems that are monopolists or oligopolists in most parts of the United States. And, wow, they think they're awfully smart, and conversely, that you're pretty stupid. So how can you be trusted to make the right decisions? The ironical part of all this hubris is our healthcare system is a disaster, and they've been running it. So why are they so brilliant? Well, they say, yeah, I've been running it, but really I need to run the whole thing. Just give it all to me. Give the entire $2.2 trillion. That's how much we spend on healthcare. That's as big as the entire economy of China, and I'll do a heck of a job on it because let's face facts, you're stupid.
And really, these people who think that we're stupid and that we don't know what's best for us are really in a position of power that, ironically, we admire the power as a populace. That 20% or that 80% really doesn't pay much attention to the solution being getting rid of these oligarchical leaders who think we're stupid.
Absolutely. But healthcare is now the number one domestic issue in the United States, according to the pollsters. And what worries people is their insurance. So clearly the people who don't have it, they're worried if they get sick, what the heck are they going to do? And, healthcare is so expensive that even if you're a middle-class person and you don't have insurance and you get sick, you're going to be in serious financial difficulty. And then even people who have insurance, first of all, they locked in jobs they don't really want. And they stay with those jobs sometimes only because the job offers health insurance. And if they were to move to some entrepreneurial, fascinating company, it likely would not offer health insurance. And then even the ones who have health insurance and don't want to change their jobs, if they get sick, getting health care from the insurance firms is sometimes a career all by itself. Just because you paid for health insurance doesn't mean you're actually going to get health care services all too often. So I write about this in my book. The book revolves around a man, a mythical man, but based on real-life facts, who has kidney disease. He needs a transplant. His daughter is willing to give him one. He's fully insured. All the stars are lined up right, but he never gets the transplant, and he dies. And the question is, who killed him? And everybody on the healthcare train, just like everybody on the murder on the Orient Express, killed him because they're so arrogant. It's not that they mean to kill people, but they really don't pay attention to their customers.
It's all about the bottom line, and it's more about a system or a procedure that has no emotion. They don't really apply common sense to a particular situation. They just look at the codes on the paper and then decide from there.
So that's a very important point. The way healthcare is paid for is very strange. There is no other industry in the United States where the supplier, the doctor, the hospital, the nurse, the rehabilitation therapist, has no pricing power. They are told what they're going to get paid by that 800-pound gorilla, which is the Medicare program, or the state Medicaid authorities, and by the big insurers. So the suppliers can't price. Furthermore, they cannot bundle care in a sensible way. So let's say you had, or I had, diabetes. Do I want to buy insurance for a hospital day, a doctor's visit, an x-ray? No. I would rather buy insurance for all the many people that I need to take care of my diabetes. But they don't get paid that way. They don't get paid for a bundle that says bad back, or a bundle bad feet, or a bundle that says depression. No, they get paid by procedure, and the irony is they get paid for treating sick people.
We have a break coming up in about 10 seconds. So when we come back, Regina, do any of the presidential candidates, have any of them contacted you to discuss a plan that will work? We'll be right back.
Jack Stockwell on K-Talk.
Hi, my name is Darrell Catmull with Destiny Real Estate. Listen to what some of my clients are saying.
Hi, this is Brent. My wife and I recently moved from Harriman to Nashville. We had a price in mind for our home and asked Darrell Catmull to help us sell. After he came out and evaluated our home, he recommended that we sell it for $12,000 more than what we had planned. Not only did we sell our house for more, but it sold in 2.5 weeks with 19 showings.
A good realtor gets the deal closed. A great realtor uses their experience to prevent problems, gets excited about a challenge, keeps you informed, and is involved with you from start to finish. Plus, I guarantee I will sell your home in 30 days or less, or it's free. You can cancel anytime, and I offer reasonable commissions. Call me for details on how we can sell your home fast. Call me right now at 262-9980. That's 262-9980. Or visit us on the web at utahhousevalues.com. That's utahhousevalues.com. Conditions apply. Welcome back to the Jack Stockwell Show. We're talking with Professor Regina Hertzlinger, one of the nation's most respected healthcare analysts. Regina Hertzlinger exposes the motives and methods of those who have crippled America's healthcare system. Right before the break, Regina, I asked you if any of the presidential candidates have contacted you or consulted you to create a plan that will work.
Yeah, I've talked with virtually all of the major candidates or their domestic policy leaders, with the exception of Edwards and Obama. And I'm really thrilled. All of them have proposed consumer-driven systems. Even Hillary Clinton, whose plan has been wrongly derided as socialist, her plan says, look, if you're uninsured, I'm going to give you a tax break, and you can go out and shop in the individual health insurance market, or if that doesn't work for you, you can try some of the plans that are used to insure the people in Congress or some variant of Medicare. Her particular plan may be loaded with hidden bombs, but on the surface of it, it's very consumer-driven. You get a tax break. Right now, if you're an individual who wants to buy health insurance, unless you're very sick, you're not going to get a tax break. But your employer, if he or she buys health insurance for you, they do get a tax break. That's not fair. She's going to level the playing field, and that's not socialist at all. It's a very good consumer-driven idea.
Well, that's refreshing. Now, in Utah, we're the reddest of the red states. So.
Yeah, in some ways.
Yeah, so are there any Republicans out there that are proposing a plan that will work?
Well, the Republicans have kind of punted. Romney, Giuliani, McCain, the big three, they've said we're going to leave it up to the states. Now, in some ways, that's wonderful. We are a confederacy of states. That's the strength of this great country. But there are some things that the federal government needs to do. For example, the federal government is the only one that can get the income tax code straightened out, the federal income tax. So they've said leave it to the states. I like that. You know, a blue state may go one way, like Massachusetts. A red state may go the other way. But it's not entirely a state government kind of issue. I think the reason they've punted is healthcare is very scary. It's the third rail of politics. It's as complicated as Iraq. And most of them don't know it as well, except for Hillary Clinton, who, of course, has studied it for years. So in some ways, it's easier to say, well, we'll leave it to the state, and may the good Lord be with you, than to really get into the nitty-gritty of what kind of healthcare system do you guys want to see.
Given that it's politics, it's probably more about they don't want to make a decision that would come back to slap them in the face. That's what I think.
Absolutely. And the Clintons, who, whatever you think of them, they're really astute. Well, she blew it the first time around. And even her husband, Bill, he had a catastrophic Medicare bill, which would have been very good for the elderly. And that blew up. You know, it's a tough field, so they would rather avoid it. But they won't be able to, because Hillary Clinton's big advantage is that she knows healthcare. She's not afraid of it. She's going to push them on it. So they're going to have to come out from behind the bushes.
Now, we've got another break in about 30 seconds. So as soon as we hear the music, we'll wrap up what we're talking about. But I think with Hillary Clinton, you've actually sparked some thought that she's very courageous for making this her issue. And even though the opponents want to call her a socialist, you've enlightened me that it's very likely not a socialist plan and that she is really being a very brave politician. So we'll be right back after this break. And then let's talk about the price of insurance in a free market.
Jack Stockwell on K-Talk.
Foreclosure is a nasty word most people don't like to face. Are you upside down in your house? Losing your house or giving it back to the bank is embarrassing and costly, so just don't do it. Call a specialist, Darrell, at 262-9980. Are you thinking that's too much hassle? No way. All you have to do is hire a specialist, Darrell, 262-9980. Paying high interest rates is a hassle. Not qualifying for a government or conventional mortgage is a hassle. Being denied credit is a hassle. Scummy people who take advantage of you are a hassle. Avoiding foreclosure is easy. Call Darrell at 262-9980. Landlords, employers, insurance, and utility companies make decisions based on your credit score. Our experience, tenacity, and creativity gets you unsurpassed results. Visit us on the web at utahhousevalues.com or call Darrell Catmull of Destiny Real Estate at 262-9980. That's utahhousevalues.com. utahhousevalues.com.
Raindrops are falling on my head, they keep falling. So I just did me some talking to the sun. And I said I didn't like the way.
We're talking with Regina Hertzlinger. author of Who Killed Healthcare. It's an absolutely fascinating book because it's written in a story format based on facts about America's healthcare. And Professor Hertzlinger is actually regarded as one of the foremost experts in healthcare. And the thing that fascinated me the most, Regina, was that you illustrated that Switzerland is already very successful. Why is it taking so long for America to adopt a consumer-driven healthcare industry?
Yeah, we've taken our money. We pay for the healthcare system. We pay for it through our taxes and through, if you get insurance from your employer, you've essentially foregone salary in the amount of the cost of that insurer. Your employer is not giving you a freebie. He or she is reducing your salary or wages by the amount of the insurance. So it's all our money. It's our taxes. It's our foregone income. It's $2.2 trillion, huge amount of money, and we've turned it over to the insurers, the government, the hospitals, the experts, without demanding accountability. So, they kind of like all this power, and gee, $2.2 trillion, that can make you fat and happy, so they're very reluctant to let go. They don't want to let it go. They don't want it opened up for competition. They don't want a lot of information about how much you get for your money. I know more about my Raisin Bran than I would about if I needed a mastectomy, about the doctor who's going to do it. I don't even know the price for surgery or anything else in healthcare. So they have real vested interest to keep that consumer, that annoying, nasty, assertive consumer, the heck out of it. I can't blame them.
Millions of people on fixed incomes need very expensive drugs. So how do we help them without creating a tax burden on this generation or the next?
Yeah. Well, in Medicare, we've already created that tax burden with the passage of what's called Medicare Part D, which is the pharmaceutical benefits part of Medicare. It's been a boon to the elderly who simply could not afford their drugs, but it's a huge cost to the American economy. Now, clearly, drugs are going to get more and more effective. They already have. That is the miracle of all this genomic research. We're getting drugs that can not only palliate but actually cure genetic diseases. But they're hugely expensive. Now, are they just going to be an add-on to the $2.2 trillion? Not necessarily, because much of our $2.2 trillion is not wisely spent. In the opinion of McKinsey, the consulting firm, we spend $500 billion unnecessarily because we have such a fat, uncompetitive healthcare system. So conceivably, we could take the money we now have, or maybe even less, and enable people to get the drugs they need and cannot afford and still spend less money.
It's a cash flow plan, basically, and it's running amok right now, and if we just pay more attention to where the money goes and be a little more astute as to the flow of money.
Well, absolutely. The problem is I'm not doing the buying. Harvard University buys on my behalf, and they take part of my salary because they can use pre-tax income to buy my health insurance, and they buy my health insurance, and I'm totally out of the picture. Now, if I got a tax break so that I could use my pre-tax income to buy health insurance, wow, would the dynamics of that industry change. I would pay a lot of attention about what happens with my $10,000 to $15,000, and we'd get all kinds of insurers saying, hey, Reggie, you can have a much lower priced insurance plan. And I would also pay a heck of a lot of attention to what the providers, the doctors, the hospitals, the nurses, the therapists, what they charge. and I would go to those that give me the best value for the money. Right now, I'm totally out of the whole purchase decision. You are out of it, and everybody who is insured through their employers, more than 100 million people, or through Medicare or through Medicaid, they're totally out of it. That's not right. We're the only ones who could make this market efficient.
What that says to me is we would be treating health care like we would auto insurance.
Yeah.
Now, what prevents a person from being uninsurable?
Well, here's how the Swiss do it. They charge people the same price in sex, age, and residence brackets. So maybe you would be charged the price of health insurance for a young man who lives in Utah, regardless of whether you were sick or healthy. The insurers then have a kind of league, and what they do is they take profits that an insurer has earned by enrolling only young men who live in Utah who are healthier than the average. And they take those profits away and they give it to the insurer who has enrolled young men in Utah who are sicker than the average. So the customer pays an average price, whether they're sick or they're healthy. But the insurers are not penalized for enrolling sick people. That's very important. We want the insurers to be interested in sick people because sick people is where all the fat and waste in our system now occurs.
Very good. That's very exciting that you have the ability to make everybody insurable. We'll be right back after another break.
Jack Stockwell on K-Talk.
Folks, welcome back to the Jack Stockwell Show. This is Darrell Catmull. I'm sitting in for Jack, who will be back on Monday for his weekly update. We are talking with Professor Regina Hertzlinger, author of Who Killed Healthcare. Regina, do you believe that alternative healthcare could be made a discipline in, say, college, so that doctors could specialize in alternative healthcare, and would it and be allowed to practice it more freely?
Yeah. Harvard Medical School has a professor, a chaired professor. I don't know exactly what his title is, but he is a physician who studied in China for many years. And he has written a number of articles on the extent of practice of various complementary medical techniques like acupuncture. I went to MIT. I'm a great believer in science. My husband is a PhD scientist, but medicine is the youngest science. We barely know anything about cause and effect in medicine. So, of course, we should study all kinds of theories of cause and effect and practice whatever works best rather than being as doctrinaire as some physicians are nowadays and saying, it's my way or the highway. That's the only way to do medicine. That's absurd.
And would alternative health care lower the cost of the overall picture? So
it may. It certainly involves a lot less surgery. In fact, no surgery. It's mostly herbal and what they call body work, massage or acupuncture, things like that. Those are certainly cheaper than the surgical practice of medicine. So it may do that. We don't know. We really just don't know enough about it. What I do know about it is the American people love it. It's a huge cash industry. Right now it's uninsured. and it may not be a bad thing for the sector that it is uninsured. And people spend more than $40 billion in cash on alternative health care. So clearly they believe in it. They put their money where their mouth is.
Yes, and I do believe that alternative health care is a big solution to people's overall wellness. If we're trapped at a job because of the health insurance that is provided to us, then that's unhealthy in itself. If we are at a job we don't enjoy, that creates stress.
Absolutely. It's also bad for the economy. We're an entrepreneurial country. All of the new jobs in this country don't come from big companies getting bigger. They come from new companies. And it's bad for the economies if talented people are stuck in a big bureaucratic firm. Not that all big firms are bureaucratic, but if the employee feels that way and would love to go to a vibrant entrepreneurial one, they often do not make that switch only because of health insurance. That's not only bad for them, as you point out, very stressful, but also very bad for the economy.
Regina, we've got a couple of callers that have some questions or comments, and I want to get Evan on from Utah County. Evan, do you have a question for Regina?
Really not a question. I just had information. One thing is that we really have a conspiracy in this way. I guess I hate to use that word in America as far as our health. We went from number one healthy nation back in the early 1900s when people had gardens and stuff, but down to 99, according to this one study. I've been following it for about 40-plus years. It started out when my mother, for example, was sick, and we went to University Hospital, and they couldn't find anything wrong with her. And so they said, well, your problem's you got too many kids. Here's some drugs and tranquilizers. And so they kept her on a ceiling for a couple of days, and she said, I can't handle my problems this way. So anyway, we prayed about it, and the Lord sent us down to Mann Mesa, Arizona, and He used herbs and massage therapy. And in a week and a half, you could visibly see a big difference, and she was getting better, continued to get better. That was just that started out my interest in alternative medicine. Dr. Darrell was given 180 test patients that were terminally ill that had cancer and AIDS. These are the worst cases the hospitals could find. And they wanted to do $1 million study to see what alternative health could do, medicine could do. Dr. Darrell was a doctor in Chinese medicine. He found that drugs, for example, were not good for long-term treatment. And so he wanted to find a cure for cancer. But anyway, he given these 180 test patients, he applied for the $1 million grant to study them. And in the first 2 weeks, he lost 6 people. And then after that, he made one change in their diet, never lost another one. All 174 were still alive after 5 years. They did. You can't use the word cure. It's a cancer cure. All those words are no-nos. But couldn't find. He says the AIDS virus is just so small, I couldn't find it.
All right. Well, Evan, thank you for your call. That's a terrific example that alternative health care needs to be an option in overall health care, including in insurance. The host that I am guest hosting for, Jack Stockwell, is a neuro upper cervicular practitioner, and he is creating those same results with people that were basically uncurable by other traditional means. And he's got story after story after story. Beyond alternative medicine,
you may not know that doctors are just as nasty to each other, that there are many important non-alternative medicine innovations that were blocked by existing status quo physicians. For example, there is a very important surgeon in Massachusetts named Uta Folkman who had a theory about how cancer tumors grow, and he thought he could control their growth with a drug. Well, his theory was very threatening to surgeons who believe that cancer tumors need to be excised. In other words, that surgery is the cure, or radiology, not a drug. And he could not get peer-reviewed monies for 10 years. The science was so powerful that it finally broke through, and now some hugely important cancer drugs have come out as a result. So, guys, don't feel you're alone. The doctors are not only nasty to you, they're nasty to each other.
That's something I never heard before. So that is very interesting that we're stuck not only because of people in power, but because of doctors who are fighting amongst each other and maybe just protecting their income.
It's all turf warfare. It's my turf, and I don't want you involved. And the whole healthcare industry, this crucially important sector with so many wonderful people in it, but it's just riddled with people whose interests are about protecting their turf.
Okay, we got our last break, and then we got 5 more minutes before this hour ends, so we'll be right back with Regina Hertzlinger.
Jack Stockwell on K-Talk.
First and goal.
45, 51, ready, hunt!
Earnest money, down payment, income, banks, brokers, lenders, credit unions, interest, underwriters, credit score, insurance.
Second and goal.
Searching, choosing, negotiating, zoning, ordinances, crime reports, utilities, accountants, neighbors.
Third and goal.
Inspectors, easements, judgments, electricians, plumbers, roofers, windows, settlement, keys, locks, closing.
Fourth and goal.
A real estate transaction is complicated. Call a principal broker and 14-year veteran, Darrell Catmull with Destiny Real Estate, to quarterback your next real estate purchase or home sale.
Touchdown!
Call Darrell Catmull at 262-9980. That's 262-9980. And visit us on the web at destinyrealestate.com.
All right, folks, welcome back to the Jack Stockwell Show. Darrell Catmull is sitting in. We have 5 minutes left with Professor Regina Hertzlinger. And we have a caller, Steve, who has a great question on consumer-driven health care. Steve, go ahead.
Hi.
Hi.
This is a great conversation. I love the fact that we're talking about healthcare, and it's something we probably should know more about. And my question gets to that Swiss model, Swiss or Switzerland model we talked about earlier, where there's an average price for a particular demographic. And I was wondering, well, what is the incentive for someone to engage in behaviors that will lead to better health if there's no financial consequences to them?
Well, that's a great question. So in a consumer-driven market, you usually get a lot of choice. So in the automobile market, there are upwards of 200 different models and styles of automobiles. So the Swiss have a lot of choice in the insurance policies, and they do have policies that reward them for practicing good health. For example, if you're a non-smoker in Switzerland, you pay 20% or more less than a smoker. They also have a 5-year policy where you sign up for 5 years, and if you're as healthy or healthier at the end of the 5 years than would have been predicted in the beginning, you get up to half your money back. In Massachusetts, where health insurance for family costs $15,000 a year, that particular policy would give you back about $37,000 if you stayed healthy. I think that is a heck of an incentive to get healthy. In an employer market where we have right now, we don't have a choice of insurance policies. We have only one kind of policy. And employers really aren't interested in these wellness-oriented policies. They don't want to pick on employees who have unhealthy lifestyle habits. They don't want to be in that business. I really can't blame them. And they have so much turnover in their labor force that they're not interested in long-term policies, in other words, policies longer than a year, that say, hey, you're not so healthy right now, but we'll enter into a contract with you, and if you get healthy over a long period of time, 3 years, 5 years, you're going to get some serious money back. That works for me.
Absolutely. I think your book is phenomenal. I hope it becomes a bestseller 10 times over and climbs the ranks, and more people need to pick up this book and read it so that they understand that there are great solutions to healthcare, and we don't need to depend on these oligarchical leaders who don't have our best interests at heart. They have their bottom line and their maintaining of power at heart. Regina, thank you so much for being a part of the show. I certainly enjoyed this hour more than any other hour I have done this week.
Oh, I'm so glad. It was a treat for me as well. And again, the book is called Who Killed Healthcare? You can buy it in Amazon. It's in the top 1% of Amazon and Barnes & Noble sellers. So I'm astonished and very pleased.
Yes, and it's not a how-to book. It's very well written. Buy the book.
Thank you.
Teach yourself about a consumer-driven healthcare system.
It's written by an old teacher, so those words have made me very happy.
Thank you very much, Regina.
Bye-bye.
All right, folks. Boy, I love that. I love learning more about how we can have solutions to a big problem. I think this is something to look at, and it's also something to look at is the fact that the Republicans have punted, in Regina's words, and said, I don't want to touch this subject, which is absolutely pitiful. So in the reddest of red states, maybe we should make them play the fourth down.
Jack Stockwell.